A survey conducted 3 years ago among the police force showed that Katakwi district had a slightly higher HIV prevalence rate than in the general population. Out of every 100 police officers, 11 are said to be living with HIV, compared to 6.4 people in the general population. This situation is worse where officers are deployed in hard-to-reach areas, such as in Karamoja.
We recruit, we train, and it's very expensive to train the police officers. But it's very unfortunate to lose a police officer immediately. That means that cost for government would have been lost.
The acting commissioner of health services at Uganda Police says the force are among the most at-risk populations for HIV, alongside commercial sex workers, fishing communities, long-distance truck drivers and others due to the nature of their work. Police officers are frequently transferred, leaving behind family members, yet they fall into the most sexually active age group. But the commissioner says lack of proper accommodation has also increased the spread of HIV among the force.
Also the very, very big problem of accommodation, where there is sharing of accommodation. So when someone has gone for duty, for example, in the night, and someone's wife is in the same room, so something can happen, and this one exposes the person to HIV infection.
That's why partners involved in HIV prevention, care and treatment are advised to support these hard-to-reach areas. MP Uganda, a financial services company working in Uganda, has supported a voluntary counselling and testing campaign worth 37 million shillings to Katakwi, specifically targeting officers attached to the anti-stock theft unit.
The medical office at Uganda Police advised us to come to Katakwi. And we're glad of that. We are happy today that we are in Katakwi and making a difference.
A team of counsellors and lab technicians were sent to 3 separate police posts of Olilim, Adacha and Katakwi ASTU headquarters. Still, officers working in such places say they find difficulties in accessing essential HIV care services and treatment.
We deploy these people where we need their services, but not where there are drugs. So we don't have access to ARV drugs, although some of us are also already on drugs. Yeah. So I was appealing to the authorities, especially Director of Medical Services, maybe to think of extending services of ARV a bit nearer to where we are deployed.
The acting commissioner health services says the officers are not deployed on the basis of their serostatus. He, however, says police officers can appeal to be transferred to another location on the basis of their HIV serostatus.
I want to assure you that police work does not involve only operational duties, running around on the streets, chasing thugs. There are so many other duties that can be done by someone who is infected or affected. There's office work. There are so many other light duties which some person can effectively perform.
He claims HIV has not affected their performance and the situation is under control. Police officers working up-country access HIV treatment in general health centers, just like other members of the public. 30 years into the HIV pandemic, it is becoming increasingly clear that ending this scourge will require universal treatment for all those infected, but also experts say that prevention strategies must target the most at-risk populations, such as the police. Anna Tkunda, NTV.